My name is Brian Scasselatti, and I build robots. In 2001, I was lucky enough to run into Ami Klin and Fred Volkmar, who asked me if I could bring one of my robots into the clinic. Now, the robots that I was building at the time were 400-pound metal monstrosities. They were sharp, they were dangerous, and there was no way we could bring those into the clinic. But my students and I got together, and overnight we put together a very simple robot demonstration. Now, when I go to robotics conferences, I can't show this because it's so simple, it's laughable. But this isn't a robotics conference. So let me introduce you to a little robot named Ezra. Ezra was made out of scraps of plastic, a few ping pong balls, and a hair scrunchie that I had stolen from my wife. Now, this little robot we brought into the clinic, and even though it was incredibly simple, we saw kids respond to it in a way that got us all very excited, both technologists and clinicians. And over the next 10 years, this effect was replicated by dozens of groups using very different kinds of robots all over the world. And I want to show you an example of what we saw at the time that got everyone so excited. This is a video of a 12-year-old boy with ASD. And this is the typical behavior we would see from him. He doesn't like to make eye contact. He doesn't like to engage in conversation. And you can tell this even without the audio on this video. But when we brought a robot into the room, like this little dinosaur robot, he became immediately fascinated by it and very engaged with it. And he jumped at the chance to interact and play with this robot. But most importantly, not only was he engaged and not only was he motivated and excited, but it changed the interactions that he had with the other people in the room. No longer was he responding just to the robot, but he started displaying behavior towards the other people that we typically didn't see him use either in the clinic or at home. You'll see him glance over and make eye contact with the woman on the far right. Now, this behavior persisted even after we had taken the robot away. That enhanced form of social interaction that we saw from him was persistent even when the robot was gone. So we really started to wonder, is this something that we could use to provide some useful tool for children or for therapists? Now, the behavior that we saw, we were so excited by, we asked the families, would you come back day after day? And the second day, the third day, the fourth day, suddenly the results started to fade. Children no longer responded to the robots in the same way. Now, we realized at the time that we were asking them to do something that was very unusual and unrealistic. We were asking them to do the equivalent of laughing at the same joke day after day. That is, we weren't doing what therapists were doing. We weren't providing new and equivalent types of interactions and engagements each day, but we were doing exactly the same thing day after day. This really became, to us then, a technology problem. Could we build machines that could move gradually from child to child, that could learn over periods of time and be responsive over periods of time, so that we didn't have that sort of same joke every day problem? This required a lot of different kinds of technology advances, because moving from the controlled environment of the clinic into the uncontrolled environment of the home, being able to adapt to the abilities and the needs of an individual child, those were hard computational problems. Now, my group had been working with tutoring systems and robots that taught to a wide variety of populations. We taught nutrition to first graders with a little dragon robot. We taught children who spoke only Spanish at home about English in second grade classrooms. We taught third graders how to deal with bullies. And we even taught 6-month-old deaf infants about how to use the prototypes of sign language. And in all of these cases, we were building the technological infrastructure that would allow us to come back and try to do this with kids with ASD. So I want to focus on one particular study as an example of what kinds of interactions robots have with people. And this is something that was published in 2018 and is probably still one of the best examples to date. So at that time, we committed to putting 30 robots into 30 homes for 30 days. And these robots were designed to do half an hour of social skills games with a child and with their parent or guardian. Now, the robot played the same kinds of games that we would have had played if we'd had a therapist who could be there 30 minutes every day on the dot, on demand. We played games based on emotion understanding and turn taking, joint attention and perspective taking. And the robot was designed not just to be an interactive partner, but really to facilitate these interactions in the home. That is, it had to do it in the home in what was the most complex environment that we could imagine. In robotics, we would rather put robots on the surface of Mars than in a teenager's bedroom, because the teenager's bedroom is much more complex than the surface of Mars. But even in these difficult environments, we were able to build systems that enhanced the ability of the child to engage with the parent. And that was one of the really important hallmarks of this. We weren't just training the child to interact with a robot, but rather we were enhancing the behavior with another adult. Now, as the kids played these games, we wanted to be sure that the robot was really having some kind of impact on this. And so we had designed these systems to go into the home for 30 days completely autonomously. We drop them off on day 1, pick them up on day 30. The robots would adapt to that particular child, changing the difficulty and also the method of delivery for the kinds of games that it was supposed to play. It worked in these very difficult and complex environments, and we used the most rigorous kinds of testing that we could imagine. That is, we relied on 3 different kinds of tests to see that the robot was actually providing some kind of benefit. First, simply, we looked at whether or not the kids were doing better in these games. And almost across the board, kids were doing better and better at these social skill games as the month went on. Second, we asked the parents, and the parents told us that the kids were engaging with more eye contact, both with the parents and with other people, that they were initiating communication more often, and that they were responding to communicative bids from other people. But most importantly, we wanted to make these measures independently. And so we had a group of clinicians evaluate these children on a 30-day schedule, 30 days before the robot arrived, on the day the robot arrived, on the day the robot left, and 30 days after the robot had been gone. And in each of these tests, for the child to succeed, they'd have to perform these social skills tests with a different adult, in a different task, in a different social context. That is, they would have to generalize what they had been doing with the robot or with some other training to this unique situation. Now, in the 30 days before the robot was deployed, the children showed no difference. That is, none of the other things that they were engaged in school or other therapies was having an impact on that time period. But in 30 days with the robot, all of our kids showed a statistically significant increase in their social performance. In this case, I'm showing joint attention measures. But after 30 days without the robot, 30 days after the robot had been taken away, their skills had gone back to what they were before the robot arrived. Now, this was exactly what we were expecting, and in many ways what we were hoping for, because we knew that no therapy was going to be effective at long-term behavioral change in just 30 days. This wasn't a magic bullet in any way. But rather, by seeing that this behavior turned on and then sort of faded away, what we were seeing is that this really was a result of the robot itself. Now, I can tell you about it, but I think it's much more interesting to have one of the parents tell you about it. So in this short clip, this is one of the mothers who had just finished the 30 days with the robot, and this is the video she sent us.
Sometimes the therapies they get a little exhausting. He's not excited, and this one wasn't like that. He was ready to play at 7:30 in the morning. That we went to the playground one day, and I noticed immediately there was a group of children playing in the sand, and he walked up to them and said, "Hi, what are you doing?" And I don't think he would have done that a month ago.
And that was the biggest thing that we saw. that kids were excited and that families were happy to be doing these kinds of social skills games. And that motivation, that excitement is what we think one of the things that these systems really bring. Now, in the intervening years, we've learned a lot about the way that robots behave and about the ways that robots engage with this population. We know that the robots enhance human-to-human interactions, that this is selective with robots. It doesn't work with things on a tablet or a phone, that we can predict the kinds of interactions by looking at the gaze behavior of the child, and that it's not just a matter of novelty or simplicity or because the robot has a limited behavior set. We've seen that there are ways in which we can use these robots to do screening, and that we're starting to understand new ways to engage kids using robots that are in many ways simpler than what the child can perform. But one of the biggest questions that we still have is, why does this work? Why is it that robots provoke these kinds of responses? And I wish I had an answer for that, but no one really knows. We know that these effects are there. We've seen them in many ways. We've seen this replicated by many groups, but we can't tell you exactly why it happens. Why doesn't it work with puppets or with other pieces of technology? Why doesn't it cause other kinds of influence? So that's one of the things as a call to action that we need to really understand going forward. Now, we're not just stopping at this point. We are continuing to try to build systems that can be deployed for longer periods of time, but we're also starting to look at problems not just for children and preteens, but also trying to understand, can we use these robots with adults to do things like job skills training, to help train you to be able to do well at interviews or to be able to respond to social interruptions on the job. This is one prototype system that we've been developing along with a team at Vanderbilt. So finally, I want to say that there is a lot of excitement about robot tutoring. They provide some really unique types of benefits: on-demand access, the ability to personalize the curriculum to the child, to enhance the engagement and the excitement around these protocols. But it also lets us quantify behavior and report back directly to therapists. It allows you to practice in the privacy of your own home with perhaps less social anxiety. And maybe most importantly, the robot can take on roles that we can't as adults or we can't as therapists. One of our favorite things to do is we have the robot make social mistakes and allow the child to correct the robot, to demonstrate their mastery. And it's a fantastic experience for them. So finally, let me end with just one caution to say that there are many systems out there right now that have been commercialized, but none of these have been proven to have any real long-term behavioral result. It's still too young. The technology is still too young to be able to buy something off the shelf. But if you are looking for something, that's going to be helpful, look for something that tries to direct not just behavior toward the robot, but between two people. Look for something that adapts to the child's preferences, to the child's capabilities. Look for something that's designed for long-term engagement. And perhaps most importantly, look for something that's designed to be thrown away eventually, that has a planned obsolescence, rather than building a continuous dependency. With that, let me thank not only the families who have been involved, but especially to my clinical collaborators and some of my students who have taken the lead on this. Without their work on this, we wouldn't be anywhere at all. Thanks very much.
Thank you, Dr. Scasselatti. I have a couple of questions. The first is, how long do you think it'll be before there's an evidence-based, validated therapy for children with ASD involving robotics?
So the challenge here from a technology standpoint is having a system that can last for long enough for us to see that kind of behavioral change. We know that we need a system that has to be adaptive, to change and respond to the individual child's strengths and needs. What we have trouble doing is producing enough curriculum into these devices to make it so that they can last for 6 months or 9 months or a year rather than 30 days. And so I think it's likely to be probably in the 5 to 10 year range before we're seeing that, just because there are some fundamental technology problems that we really need to address.
And how do you see the development of and the use of robots being changed by the pandemic?
We've seen actually an increased demand for them, if nothing else. Um, uh, it certainly made research more challenging. Our students were not allowed to actually work with the robots in the lab, much less to have contact with other people for a long time. But we've actually had a call for more and more of these pieces of technology, especially in the education settings, as we're looking at children who are spending more time on their own learning rather than with groups of peers. Having some type of one-on-one tutoring that's at your level, that's there when you need it, that's there present physically with you on demand. We've seen a lot of emphasis on that. I can also say there have been other efforts to look at things like whether we can reduce social isolation using teleoperative robot play. And if you're interested in that, there's a site called robotsforgood.yale.edu, and you can look for the project there.
We have another question that may fold into what you just said, is that robots may create responses that are predictable, whereas humans sometimes have unpredictable responses, which may be more anxiety provoking for people with ASD. What do you think about that?
So actually making robots unpredictable is one of the easiest things we can do. And in many cases, one of the challenges of doing this is actually putting together systems that are reliable enough and robust enough that we can compare them accurately from one deployment to another. The scariest part of putting robots in the home for 30 days was that I had no idea what they were going to be doing by the time the second day rolled around. So while it is true that we think about robots as being sort of repetitive mechanical automatons, modern robots have very easy capabilities to be able to vary their behavior over a wide range. So I don't think that's one of the things we're likely to run into as problematic in the near future.
And then one final question before we have to break. Are there responses different in boys and girls to robot therapies?
We haven't seen much of a gender-based difference in responses. Now, we've been working primarily with kids under the age of 12, so preteens for the most part. And we are very conscious about trying to make these robots appealing to both boys and girls and to kids, regardless of what they envision the robot to be, however they gender the robot itself. If anything, we see just as much caregiving behavior, just as much interest and excitement in the robot in boys as we do in girls. And that's not what we see when we think about adults interacting with technology.
Thank you. Thank you, Dr. Scasselatti.